So as you heard, back to school right around the corner, and universities are now announcing their mask and vaccine rules for the fall semester. And it's a bit of a mixed bag. Depending on where you are, there may be a vaccine and mask mandate or not. We're joined now by Mukarram Ali Zadi. He is a family physician and epidemiologist in Calgary. Dr. Zadi, thank you so much for your time.
Thank you for having me.
So some universities will still have mask mandates in place, and other universities, for example, Western University in Ontario, requires that students be vaccinated with at least 3 shots. So what do you think of these measures that are being announced?
I think we are still in the phase of the pandemic that was going on and kind of at the tail end. And Western Canada is looking at the best practices. And what we have seen that people who have 2 vaccines and a booster, now when they're contracting COVID-19, it's like a cold, cough, just like a light flu, diarrhea, body ache. But they're not developing severe symptoms of shortness of breath. They're not ending up in the hospital. They're not occupying our ICUs. And furthermore, so when people are contracting COVID-19 right now, they have cold and cough, a little bit of body ache. So they might be a carrier and go to university and then spread. So I think what Western Canada is doing, having a mask mandate, is preventing the spread if people have COVID-19.
In terms of what you're saying here about the risk that can be avoided when it comes to being vaccinated versus those who are not, I'm wondering what you're expecting to see when it comes to universities who do have mask mandates, some universities like Western, who are requesting that students have 3 doses or a booster shot as part of a requirement to be on campus, versus the universities that are not having a mask mandate, are saying it's mask optional. Do you foresee different paths in terms of the COVID battle, the COVID journey at these particular campuses once classes resume?
So evidence-based that we have seen so far is that masks have been preventing the spread of the disease. So we can only see it in the fall or in December to see whether there was a difference or not. Looking at the spread of the disease in class or on campus, and I truly believe and look forward to see the results by Western Canada taking a lead of the best practices and having a mask mandate.
Now, you're actually faculty at the University of Calgary, for example, and at their med school, and masks are encouraged on campus. So what's your comfort level being in an indoor environment where masks then are not mandatory?
So at our clinic, we are still wearing masks, and I do wear a face shield as well. Whereas and every hospital has a mask mandate. Our airports and our planes have mask mandate as well, and it's just another way of protecting other people by preventing if somebody has a cold or cough and kind of mild symptoms of COVID-19, because there could be some people within the community who have immunocompromised, could have endocarditis, could be suffering from cancer and going through chemotherapy, and they end up with cancer. They end up with COVID-19 would have more severe consequences. So my comfort level would be having a mask mandate when you're indoors.
Given the fact when we're looking at all of these universities, there's a bit of patchwork of sort of rules and regulations across the board, and that kind of reflects the country as well. But for the most part, the country, many facilities have opened up in the sense that there aren't gathering limits anymore. Mask mandates, for the most part, are not in place. So do you think that there will be compliance or cooperation, or do you think that these sorts of mandates fit with where society feels in terms of the pandemic?
And again, we have a lot of research that's available, a different level of evidence that's available. And at the end of the day, every institute, organization, city would have their own level of comfort on managing the risk. I believe that what Western Canada is doing is the best practice to have basic vaccination with 1 booster and having a mask. Now, the compliance could be an issue because in the community they're seeing there are no limit on if you go to any sports event and going to any club, there are no masks. I do see and anticipate some backlash from the students.
Do you think that there might also be more broadly outside of school a return to different sorts of COVID measures come the fall?
I hope so.
And finally, I wanted to ask you about immunity, given the fact that many people, we've seen sort of a decline in people getting the booster shot, so immunity is waning, and that is a few months after the shot. So should administrators keep that in mind when deciding what measures to impose on a campus?
At the same time, you have to see about the virulence and the morbidity with the new variants, where we are seeing that the hospitalization has decreased, the morbidity has decreased, right? So we cannot say today that it's like a cold or a flu, but only in time we can say that do we need the fourth, the government has allowed to take the fourth booster. So at this point, it's about everybody which they would like to take the fourth booster or not, especially youth, and people who are immunocompromised should definitely take the fourth one. So it will really depend upon how the statistics come forward, how many people are hospitalized, what's the virulence of the virus going forward.